Welcome back to Plastic Surgery Decoded, the podcast where we demystify plastic surgery and provide a foundation for understanding it, whether you're actually considering a procedure or you're just curious. As always, I'm your host, Dr. Regina Newhan, and in this season number 4, you'll find a new approach, including interviews and covering a wide variety of subjects. But after you listen to this episode, I encourage you to go back and really explore the previous seasons, as they are full of valuable information. You get to pick and choose what to learn about next. Season 1 covers common aesthetic or cosmetic surgery topics and skincare, while Season 2 explains reconstructive surgery topics. Then Season 3 goes over general questions about plastic surgery. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So stay tuned for this interesting journey we'll take together in the ever-expanding world of plastic surgery. Let's go! The field of plastic surgery has grown immensely since its origin long ago. And sure, by that I mean there have been major developments over the last century, but I don't just mean big changes. It continues to evolve even incrementally every few years. So who better to help us delve into how plastic surgery has changed even recently than someone who has had a successful career in that field spanning decades and who has seen it all? Dr. Robert Grant not only fits that bill, but he has extensive experience in educating new plastic surgeons. Take a listen as he shares his thoughts and perspective on this subject. Here's our conversation. Well, today we have Dr. Robert Grant. Now, Dr. Grant has been a plastic surgeon in chief at New York Presbyterian Hospital, the University Hospitals of Columbia, and Weill Cornell Medical Schools. And he's directed a plastic surgery residency program, and he is so accomplished. He is currently retired from practice, but serves as dean for St. George's University School of Medicine. He's also professor emeritus and holds numerous appointments at esteemed institutions in the Northeast. Welcome, Dr. Grant.
Delighted to be here, Regina. So nice to get to chat with you and your listeners today.
Gosh, well, you have had a long career in the practice of plastic surgery, and though you have shifted focus to another role, could you just tell us where you practiced and what types of patients you saw? What types of cases did you do?
I love plastic surgery. I loved it from the first opportunity I had to participate in plastic surgery operations when I was an intern. I had no idea what plastic surgery was when I was a medical student. It was nothing that I had aspired to when I wanted to be a doctor.
Yeah.
But I fell in love with the fact that we operate all over the body. We still are the last of the great general surgeons in that we get to do many different kinds of operations.
Yes.
And with that, I focused on an adult reconstructive practice as the basis for my interest. It wasn't until I got into practice that I realized the value of aesthetic surgery as well, and how lives are changed differently by aesthetic surgery. And I had a robust adult reconstructive and aesthetic practice until 2008, when a couple of things happened. The first was, of course, the recession at that point. So people had no ability to spend money on aesthetic operations the way they did before.
Sure.
And second was all of the wonderful wave of minimally invasive, non-invasive treatments like neurotoxins and fillers, which we began to really help people, number one, get a foot in the door without having to commit to an operation and a recovery, and really focus me more on a health and wellness approach to my aesthetic patients than just merely being a technical operator who did a great job, because that was just no longer enough.
Yeah.
So I love the innovation in plastic surgery. I love the fact that we can operate all over the body. I love the fact that even if we are doing the same operation, the wonderful thing about the human form is that it comes in so many sizes, shapes, and colors, that if you are doing an operation on a breast, you've just done one operation on a breast. Whereas, when I was a general surgeon and I was taking out gallbladders, once you figure out the 7 or 8 different ways that gallbladder takes off from the liver and exducts, once you get under the skin, we're all pretty much the same on the inside. So I love the fact that we're different on the outside and that there's an immediacy to seeing the impact of what you do for someone. You can't hide your bad result under the skin.
That's exactly right.
It's right there for everyone to judge. And I realized that that fit my personality wonderfully. I love the episodic nature of having a problem, being able to come up with a solution, and some of the reconstructive stuff, having to think on my feet and be the person who a colleague would call in when they had come to the limits of their techniques or expertise. And so it was just intellectually challenging. Every patient was different, even if the operation I was doing the same. And the gratitude that I received from patients, the bravery and courage I saw in many of the
Sure.
reconstructive patients was just so fulfilling. I used to tell people that being the kind of plastic surgeon I am, I add life to people's years. I don't add years to their life. And a lot of what we do in medicine is really to make people as whole and as healthy as possible to use the time that they have on this earth.
Hmm.
So I'm very happy. I realized I wasn't going to be the kind of surgeon who was going to have a long and prosperous career telling people that I did my best, but the cancer was going to get them.
Gosh.
So I got out of those kind of rotations, the realization that they weren't for me. And I salute our colleagues who do that kind of work because it's really,
Absolutely.
the deep down in the trenches. But I
Yeah.
found something that fulfilled me personally and professionally, and I've never looked back.
Well, you have expressed that so eloquently and gave a lot of insight to the listeners as well. For those listeners who are still not clear what reconstructive plastic surgery is, can you just, maybe name off a few categories of things that a reconstructive plastic surgeon might do?
Yeah, great question. And the big difference is that aesthetic or cosmetic surgery takes normal tissue and modifies it, whereas reconstructive surgery takes tissue that is not normal, whether that because it's a birth defect, like a cleft lip, or it's because a woman or man had to have their breasts removed to treat a malignancy, or because they were in an accident and lost tissue or a scar developed. Those would be the main differences between cosmetic and reconstructive surgery.
Hmm.
What's wonderful as a plastic surgeon, of course, is that the techniques we use go back and forth between those realms, and there aren't strictly techniques that we just use for cosmetic surgery and techniques that we just use for reconstructive surgery.
Yeah, exactly right.
So it's really wonderful that we don't have a specific anatomic limitation to our practice. You go to an orthopedic surgeon, they're going to be working on bones and joints. You go to a neurosurgeon, they're going to be working on the brain and the spine. You go to a plastic surgeon, you don't know what kind of plastic surgeon you're going to be dealing with. We've got plastic surgeons who do hand surgery. We got plastic surgeons who do children and craniofacial problems. We have plastic surgeons who specialize in using the operative microscope to move tissue, lifting it free from the body and transplanting it to another place. We have plastic surgeons who focus strictly on cosmetic surgery. So
Yeah.
ours is such a wonderful, diverse, and inclusive profession, and I just love being a part of it.
That's exactly what I love about it too. And it's something that I express to everyone who asks me about it. And they do have a very focused understanding of what it is. And it's primarily aesthetic or cosmetic surgery, but there is so much more to that. Of course, we'll talk about a little bit of everything today. Now, I did mention your new role, but would you just briefly explain to the listeners what you're doing now?
So now I am the clinical dean for an international medical school. And it just so happened that this opportunity came up where I'm no longer taking care of individual patients, but I'm helping to address the healthcare needs of our local, national, regional, and international communities by educating doctors to be who want to be the kind of doctors that their communities need, namely primary care doctors and not specialists like I am. So it's been wonderful to still have a role in helping people stay well and get better, just not in the operating room.
Yeah, well, it's a very noble role, and we're glad you're doing it, especially with all the knowledge that you have. Well, I'd really like to take advantage of all of your years of experience practicing plastic surgery. And again, you've led both plastic surgery departments, a residency program, but I'd really like to talk about the changes that the field of plastic surgery has seen, really even over the last couple of decades. There's just so much we could talk about, but let's just start by trends. Have you noticed trends for different types of procedures? Just in general, what is your impression? Do you think patients have different goals now?
That's a wonderful question and really allows me to talk about a number of different things. So please make me focus if I'm getting a little bit too far off piste from the main point of your question.
No worries. We want to hear it all.
Thank you. I've had the opportunity to see and experience the many changes in plastic surgery. I mean, the operations that I learned how to do when I was a resident are very different than the kind of operations I was doing towards the end of my clinical practice.
Mm-hmm.
But I think there's some really awesome things about the future for plastic surgery. The first, and I can tell you this from my perspective as a residency program director, we still are attracting the best and brightest and smartest applicants into our residency training programs. So
I love that.
that is unbelievably reassuring about the future of our specialty, that we will have really smart people who will continue to innovate and will continue to grow and help our specialty transform as it must, given that society has changed and the demographics of aging have changed and people's expectations about how they're going to age have changed.
Mm-hmm.
So that's number one. Number two, which I have always been an advocate for, is that we need to have plastic surgeons look more like our patients. Now, I know I'm a middle-aged white guy, and
Yeah.
I operated in a city that was very multicultural and diverse. The vast majority of my patients, I think there were very few middle-aged white guys that I operated. So the trend of allowing underrepresented minorities and women to succeed in plastic surgery will benefit us all. Number one, because the patients can relate to someone who looks like them and may have their same gender traits better than they can many times interact with a middle-aged white guy. But it also brings in a much broader perspective on beauty and aesthetic ideals than just what was traditionally taught when it was only people from Northern European backgrounds who were the ones who were writing the textbooks and saying this is how you do this particular procedure or not.
Yes. Excellent point.
So I think those trends are really exciting trends and ones that I am just absolutely over the moon about helping to navigate in my time in a leadership role. As for the operations, there is all of this focus now, of course, on what people are going to do with all the skin that's resulting after they've taken their GLP-1 medications.
Right. Like Ozempic and that kind of thing.
Who would have predicted that just a couple of years ago?
I know.
There's also, at what age do you really start thinking about a surgical solution or a minimally invasive solution or a non-operative solution to start to either deal with things that you don't like about your appearance or to even delay the onset of things that you don't like about your appearance. Mm-hmm. And all the technologies that are out there in our wonderful world of aesthetic surgery, I think, continue to innovate very much like, the iPhone has a new generation every year. It seems every year there's a new light-based therapy or some sort of energy focus that's going to really facilitate people's battle against premature aging.
That's a great analogy. I love that.
But I think thank you. But I think the really, really exciting thing is to understand and lay the foundation, which I always did for my patients, that we really aren't anti-aging specialists. We can't turn back the clock. And I always tell my patients that my philosophy is one that we are going to make you look as good and as healthy as you can for where you are in your stage of life.
Yes.
So when you're a teenager or when you're in your 20s or after, if you're a woman and then you've had kids and then if you're approaching menopause or whatever, you naturally are going to look different. Obviously men, we have it a whole lot easier because, we don't have all of the issues related to the loss of the fantastic beauty of estrogen, but, it does play a little bit more for men. And it's really where we integrate health, wellness, and aesthetic surgery, plastic surgery, because they're complementary. One doesn't work without the other.
Right.
It's the same way that we have every plastic surgeon who does aesthetic surgery and even reconstructive surgery too has a network of colleagues who they interact with. When I was doing breast reconstruction, I had the breast surgeon who I worked with. Now I have the cosmetic dermatologist or the facial plastic surgeon, the oculoplastic surgeon, people who have specific areas of focus or expertise that are complementary and overlap ours. And I think that's wonderful if you get a team of people together and celebrate the fact that you're all trying to help the patient and not think that the competition is going to hurt you or your practice
Yes.
or your patients.
I love this.
The competition in everything in life makes you better. I mean, that it has to. If you don't have someone nipping at your heels, human nature, in my humble opinion, is such that, you're going to rest on your laurels and not be pushed to constantly improve upon yourself. So I talked about a lot of things. It isn't really the operations that are that different than what I learned, but it's the philosophy, it's the kind of patients, it's the age group, it's the camaraderie, the collaboration,
Hmm.
not only with colleagues, but also with industry who really needs us to help them where they're going to put their research and development efforts.
And for the listeners, could you explain what you mean by industry?
So all doctors have tools that are supplied by somebody. A surgeon has surgical instruments that are made by someone. A hospital has sterile gauze that's supplied by somebody. We as plastic surgeons have various things that we use in our practice that are supplied by industry. And we always want to make sure that what we're doing is creating win-win situations so that, of course, always the patient, they're winning first. Your practice wins financially, and then the company is encouraged through our feedback to continue to make products that are meeting needs that we identify.
Hmm.
So when I say industry, I mean the companies that are making neurotoxins, fillers, breast implants, other devices that we use to make sure that they are giving us and we are collaborating with them to develop the tools that will continue to allow the innovation that will make plastic surgery continue to be so exciting in the future.
Hmm. One thing I do want to ask whether you had some observations about, there does seem to be kind of over the last maybe 10 years or so, or maybe a little longer than that, kind of a tendency aesthetically for patients to want a more natural look, shall we say, or, in terms of physique. We hear about the ballet body, the athletic and kind of, not overdone kind of thing. But just in general, a little bit of that less is more philosophy. Did you notice that in the later years of your practice in plastic surgery?
So Regina, I love plastic surgery. I don't love plastic surgery marketing. Things like ballerina body and mommy makeover, they're really catchy phrases,
Right.
but it is not what I ever practiced. I can move skin around, and I was successful because when I had a consultation with an aesthetic patient, I would take that piece of tissue and say, is this going to make you happy if I move this to there? Or if I remove this? Or if we put in an implant and we enhance, your physique? You know, drilling down into what the patient really expects is what makes one successful.
Hmm.
And not doing that makes someone who doesn't really know what their motivation is potentially a very unhappy patient. So I think the reality is that, yes, there are trends that are influenced by celebrities and movie stars. But as I always told my patients, I've taken care of celebrities and movie stars. They do things to their bodies to get a role. It's their job. You know, you don't need to do what the particular people on cable TV are doing to themselves because that's not your job or your life. So don't come to me. Oh, I'll put it this way. I used to love when a male patient would come in and say, I want to look like Brad Pitt. And I'd say, well, I want to look like Brad Pitt too, but that ain't going to happen. I can take the bump off your nose and give you a slightly smaller nose, but
Right.
you're not going to look like Brad Pitt any more than I am after your nose is a little bit smaller. So when they come in with pictures of, and Brad Pitt is a very good looking guy, but I just use him as an example to say,
Sure.
that for me was a huge red flag where I'd have to spend a lot of time making sure I could understand what the patient's motivation was for the surgery. And yes, there are very valid motivations for doing a mommy makeover or for having your implants downsized so that you're not as big in your 40s and 50s as maybe you were in your 20s and 30s.
Hmm.
A lot of this is regional. I remember, Professor John Tebbets coming up to New York, and we were so excited to have him. Your listeners may not know Dr. Tebbets was one of the most famous names in breast augmentation surgery.
Yes.
And he would look at our results in our New York women, and he'd say in that Texas drawl, Bob, you're not even doing the operation. You could put an implant that's twice that size. And I'm like, John, I know everything is bigger in Texas, but in New York, this is what our women want, and we
Exactly.
give the patients what they want.
Yeah.
So maybe in your state, you are the captain of the ship and you decide, but here in New York, I am just the first mate. And
Oh,
I partner with my
I like
patient
that.
and help them make the decision that ultimately is going to make them as happy as they can be. Because at the end of the day, they're going to walk out of my office and I'm not going to see them again, a couple times post-op and then some follow-up visits. But they're going to be looking at themselves and their significant others are going to be looking at them every day for the rest of their life. So who is more important to make happy, the plastic surgeon or the patient?
Exactly. I tell you. Well, and you bring up a great point that patient expectations and that alignment with the surgeon is just so crucial to the success of whatever procedure is at hand. So I'm glad you've pointed that out. As we talk about how plastic surgery has changed over the last few decades, do you feel like there are surgical procedures or rejuvenating treatments available now that didn't used to be? I mean, I think there are, but what's your impression about that?
Oh, and it goes back to what we were saying before about how all of the interesting technologies, the minimally invasive world that has to do with freezing fat or
Yeah, fat grafting.
fat grafting, neurotoxins, things that were not part of my formal education that I had to continue my education to learn
Mm-hmm.
about. And because I was teaching other people, I had to really learn about them.
Mm-hmm.
I had to become expert in all these emerging technologies and really cut through the marketing to the reality of what this really could or could not do. We talked about industry. One of the downsides is that, of course, they're in business to make money. And so they oftentimes tend to slightly exaggerate the advantages that their particular technique or technology may offer. So you have to be very careful about that. But that's why we, as long as you put the patient's interest first, all the rest takes care of itself. And that was
Yeah.
one of my main teaching points to the, hundreds of residents that I mentored and who graduated from my program. I said, I get it. You've given up a decade plus of your life at less than minimum wage to learn how to do this. And, your significant other wants to know when we're going to be able to afford a home and a nice car and pay off our educational loans. But boy, if you put your personal financial interests ahead of what's right for the patient, you're just going to be in deep trouble faster than you could ever imagine.
Of course.
So just imagine every patient is your mother, your sister, your father, someone that you love, and you would do the same for them as you would want someone to do for your parents. And then everybody knows what's right and what's wrong. I mean, we've all gotten
Yeah.
to this point as adults in our life, if you've gotten into medical school and into residency training. And one of my mentors, actually two of them said the same thing. Lloyd Hoffman, my immediate predecessor, was known for just saying, Bob, just do the right thing. You know what the right thing is. And that was his way of saying, just make sure that you were doing what's right for the patient. And then the rest will always fall into place.
Well, that's what patients really want. They want to hear that their surgeon has first and foremost the tenet of do the right thing and to treat them as if they were, a family member and really have their best interests at heart. So I think that's a great point to bring up. We've talked a little bit about collaboration with other subspecialties and different points of view coming towards the patient and trying to take care of their problem in the best way. I'm thinking of this newer, I will call it, area of medicine called regenerative medicine. Have you interacted with that? How would you define that, first of all? And what's been your thought about how that can enhance what we can do as plastic surgeons for the patient?
I think this is a perfect example of the kind of innovation that plastic surgeons are championing as our specialty moves forward. Regenerative medicine is, however, a bit of a marketing term, and I think I've already shared my feeling about marketing.
Yes.
The marketing of regenerative medicine, in my humble opinion, exceeds the documented benefits to date. I think the future potential is outstanding, but
Mm-hmm.
to see people paying to have, for example, PRP treatments to help with their alopecia, I just don't know that that is something that we can say is, number one, conclusively proven in a scientific way, and then number two, worth the money that you're going to get charged to do it.
Mm-hmm.
There's a reason why insurance companies in the reconstructive world won't pay for PRP injections to your joints so that you don't have to have a knee replacement, for example, or other things. Show us the data. I mean, it's so sad that one of the byproducts of this horrible COVID pandemic was that people just don't trust scientists the way that they used to anymore.
Oh, I know it
And
is.
people are promoting their particular analysis of data, or not just creating and letting people truly understand and evaluate, because there's so much of a profit motive in the way, and people don't want to give away, quote unquote, their secret sauce or what it is that they're doing. That's just real world. I mean, those conflicts have always been there. So I'm wonderfully enthusiastic about it. I think it's great. It's part of the minimally invasive trend, which is going to continue to predominate.
Mm-hmm.
But I don't yet think it is able to meet what the marketing says it can do.
Fair point.
And I just tell patients to be very, look, it probably doesn't hurt. It'll hurt your wallet. That's for sure.
Right.
It'll make your wallet lighter.
Yeah.
That's a definite. But whether it's going to do all the magic, wonderful things, we all want a silver bullet. I mean, who wants to eat less, exercise more, and sleep more? I mean, yeah, those things are good, but I'm not a monk. That's not the kind of life I
Right.
want to lead. I want to have fun, enjoy a good meal,
Yeah.
enjoy an adult beverage every so often.
Yeah.
And therefore I got to really continue to work out and watch what I eat and do other things on those times when we're not being
To
celebratory.
balance it out.
Boy, wouldn't it be a whole lot easier? And that gets us back to the GLP-1 things, where people say, well, wait till the oral versions come out. And then, boy, that's going to make a difference. And that people will just take this pill, and then
Rather than an injection.
it sounds like something Orwellian that, then they're just not, if they're right now, too many people don't want to have to deal with the shots. But
Yeah.
boy, there's scientists, I'm sure, at pharmaceutical companies all over the world working as we speak
Oh, you
to
know
get
it.
these oral agents to be as effective and have longer duration and do all the things that would make it so that people's appetites and other potential addictive behaviors are taken care of with a pill and not with behavior modification.
Yeah. Well, what about safety in plastic surgery? Have we made improvements in that regard, or at least, a little bit more aware about its need?
Couple of thoughts about safety. Number one, I'm thrilled you brought it up, because it gets back to what we were just saying about, if you're having someone operate on your mother or your sister, you want it to be done in a safe environment as possible.
Sure.
The reality, however, is that for aesthetic plastic surgery, many, if not most, of the operations are done outside of the traditional safety net that exists if you're in a acute care hospital.
Right.
So, if you have an incident in an operating room that's in part of a hospital and you cry for help, you're going to have 10 people run for help. If you're in your office operating room where it's you, a scrub nurse, and, an anesthesiologist who's just there for the day, and you cry for all hands on deck, well, all hands are already there. And then
That's all you
that's a
got.
problem.
Yeah.
That's all you've got. And hospitals exist for a reason, because they've got all these specialists and people around to help each other out. So I salute the fact that, number one, our Plastic Surgery Society mandates that we only operate in accredited outpatient facilities.
Mhm.
I also celebrate the fact that we have an organization in the aesthetic surgery world that's called Quad ASF. And the Quad A is the 4A's that stands for the American Association for Accreditation of Ambulatory Surgery Facilities,
Mhm.
so that there is oversight in particular about many of the safeguards, not just in terms of cleanliness and turnover in the room, but policies and procedures. God forbid something goes wrong. Where's the patient going to get transferred to? Does the hospital have an understanding that a plastic surgeon operating in his or her office may call and say, I have an emergency? Will they facilitate getting a private ambulance there? So lots of planning ahead, which is something we are very good at as plastic surgeons,
Mhm.
has made outpatient aesthetic surgery as safe as ever. But, it's still, if you've got health conditions and medical problems, even if you want to have that cosmetic surgery procedure, sometimes there's no better place to do it than in a hospital, unfortunately. And that's going to mean you're going to pay for that safety.
Yeah.
So the cliche, safety is job one. I mean, I know I take that from our friends who make automobiles.
It works though.
And I think we do a lot better job of actually ensuring that safety is job one for us as plastic surgeons, based upon the recalls I seem to get every week about my car.
Right.
But it just cannot be emphasized enough that one of the things that you get as a patient being cared for by a board-certified plastic surgeon, and by this I mean the American Board of Plastic Surgery plastic surgeon, some of these other boards that are self-regulated or self-promoted, is you have somebody not only has the education, experience, and background, but has committed to practicing in the safest environment possible.
Mm-hmm.
And so I think that's why it's just so important to reassure our patients that we are advocating for them. And if, I won't operate in a place that's not safe.
Mm-hmm.
That just doesn't do the patient or me any good.
Mm-hmm. So just to reiterate a little bit, we have better standards and protocols that are required that kind of facilitate safety as much as possible. And we have certain standards for the surgeons themselves in terms of their level of education and achievement before they're really able to operate on patients.
You're absolutely right. And I just have to say one last thing.
Yeah,
Everybody who operates gets complications.
that's a good point.
It's part of the human experience. And just because you're a well-trained plastic surgeon who operates in an accredited facility doesn't mean that your patient isn't potentially going to get a complication. So you want to be able to be taken care of by somebody who knows how to take care of their complications.
Mm-hmm.
The best plastic surgeons I know are the ones that I saw manage their complications better than anybody else. And I got to that point in my career where I got to take care of a lot of other people's unhappy or dissatisfied kind of patients.
Mm-hmm.
So I have a lot of experience with dealing with expectations and safety and making sure that things were done by the book, which, sometimes it's boring and you can't give people what they want and you have to tell them, I'm sorry, you're not going to be able to do what you thought you could do a week later because the other surgeon said they could do that. But again, it's just central core idea. Put the patient at the center of everything you do. Imagine it's you or your wife or your husband and just go from there. And then the rest of it is doing the right thing.
It's a really good principle. Well, I'm curious what you might see on the horizon. I know you've stepped away from practicing as a plastic surgeon, but you have had so much experience and so many thoughts during your career. I wonder what you see on the horizon. Are there any advances that maybe just aren't here yet, or something you'd like to see be pursued or developed? What do you think?
I think that there is exciting stuff going on in the world of regenerative medicine. And by that, I'm going to also include fat grafting, stem cells, and other,
Sure.
I would call reparative technologies, that things that will help us. Some of the exciting stuff that I can't talk about, for example, that I've seen to potentially replace the silicone gel breast implant with something different, combining other techniques and technologies that don't require microsurgery, I think is really, really going to make a difference in terms of giving more women access to reconstructive surgery. Right now, the silicone breast implant is a fantastic device for a large number of patients who need to have their body made whole after they have to give up a breast to beat their cancer. But it has, as we all know, some significant downsides associated with it. And if we can come up with something better, so I predict, and it'll be 10 or 20 years before these ideas that I've seen being proposed and are being worked on in different animal models, being done the right way,
Innovations.
will probably come to fruition. But I think that's number one.
Yeah.
I think the other thing that's really exciting has to do, as I say, with more integration of not being just reactive as plastic surgeons, but proactive.
Yes.
So traditionally as MDs, we are trained to treat illness, and prophylactic stuff, has not been a focus of anyone's nutrition, whether that's and anyone's education, whether that's nutrition or other things. And we have an uphill battle here because, look at the debate about vaccines, which is probably the best, most clearly documented prophylactic benefit that we have in modern medicine. But I think we'll understand that we can use many of the same techniques modified in addition to either a pharmacologic or nutrition type approach to get better results that last longer. So what do I mean by this? I found in my practice that if I waited to recommend a facelift to a patient who was 5 or 7 years postmenopausal, the results just didn't last long enough. And it didn't matter which technique I used. I was a subsmass kind of guy. And for the listeners, that means the layer of fascia that overlies the muscles of the face, I would dissect that out and elevate it to give a longer lasting result. The challenge there is that when you don't have as I said, that miracle hormone estrogen to keep the skin elasticity and pliability vital, then it doesn't matter what I do. The skin is eventually going to sag. And then you start looking operated on. You don't look better.
Mm-hmm.
So I found that operating on patients a little younger and maybe not even having to do as aggressive a facelift as I did.
Just a little reset.
Exactly. That's a great term. Would give them the opportunity to age more in sync with their expectations as opposed to aging out of sync with what they expected. And they look at themselves in the mirror and then they say, oh my God, who is that person looking back at me? If you start a little bit earlier and maybe do a little bit less, and then add some of these regenerative things which are coming down the pipeline, whether they be things like PRP or other little, we call them in our world, like little peptides or other little types of things that companies are working on to enhance the body's own repairing and rejuvenating kind of potential. I think that's going to be exciting. One of the big advances, as you know, was that people started to add fat grafting to facelifts. Not because it added volume that you've lost in the face and that you age, but also because the stem cells within the fat also made the overlying skin act younger.
Yes.
So we are just at the earliest stages of things like this. And those are just a couple of examples of things that I think will find us modifying our surgical techniques, combining a multimodal approach to a holistic kind of attack on the aging process. And as I said, aging is inevitable. No one gets out alive, but the idea is to make people look as good as they can, giving their life experience, giving their genetics, given the illnesses that they may or may not have got, given the choices they make about drugs and alcohol and sun exposure and those sorts of things.
Yes. Well, some wise words and also some very exciting concepts to think about and anticipate. Well, Dr. Robert Grant, this has been a wonderful talk. I wonder if you have any final thoughts for our listeners, anything you'd like to part with?
Well, I would just like to say how delightful it is to chat with you and to have this opportunity to be given a podium where I could share some of my experience and observations over the course of a lifetime in plastic surgery. So thank you and your listeners for allowing me to share with them a little bit of who I am and what I'm thinking.
Yay.
The thing that I would only close with is to reiterate the points that we made in terms of patient safety, choice, and to make sure that if you don't feel like the surgeon is the person for you, there's lots of other good people out there to go get another opinion. I loved when my patients got second opinions. And it was particularly satisfying when they came back and they said, oh, the other doctor said the same thing as you.
You were right.
Or the other doctor said this, what do you think? So, that was, and it's difficult for younger plastic surgeons. I also learned to say no to patients. If I wasn't the guy,
it's tough.
I would admit that. I said, look, I hear what you're saying. I can't get that for you.
In my hands.
Now, here's some people whose opinions I would trust. You may want to consider seeing. And then I would refund the consultation fee. I say, look, I'm not the person for you. But this isn't something that you should ever feel rushed into. And you should take advantage of the fact that just about now every major and not so major metropolitan area in the United States, there's some really great, well-trained people who are ethical and honest and want to do the right thing for their patients. So seek them out. The best way to find them is to ask the nurses. So if you're a woman and you've got kids and you're going to be taking your kids to the pediatrician or you're going to have some of your own healthcare issues related to be a woman, ask the people who you're interacting with, not in the plastic surgeon's office, but in the other departments. They know who the good people are.
Yes, that's true.
And they're more than happy usually to be giving a testimonial, whether it's from their own experience or for somebody else they've seen. So that's my final bit of advice. Don't go online. Don't go to social media. If you're really considering something and don't have a reputation or a recommendation from your primary care doctor or a trusted healthcare professional, the next time you're in another doctor's office, don't ask the doctor, ask the nurse who they would go to or who they would recommend if they were considering cosmetic surgery.
That is brilliant. I love that. Well, Dr. Robert Grant, thank you so much for taking the time to share some of your thoughts with us. It's really been a treat chatting with you and hearing your point of view.
I wish you and your listeners all the best. Thank you so much.
Take care. Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.